Srinath, and thank you Sanjay for such a wonderful meeting. I don't know why he asked me to speak on Jugad, but I think it's a very interesting topic. I would like to really thank many people I wrote about Jugad, tell me examples what you have really done. So some of them responded, so I have included them. But I'm sure everybody of you continue to do these kind of Jugads. Now I'm sure advances occur by innovations. Innovations is the key for any surgical procedures. In fact, innovation is a progress when it improves the human experience in a whole. Innovation in health is now coming in a big way with AI and changing healthcare. That the first, I always remember Amazon, we all use it, but the word Amazon came from Amazia, how those women did innovation to removal of one breast of archery. But the story of Halsted and Hampton, everybody knows that probably she had irritation and then she used rubber gloves, which were innovated by the Halsted, and which really brought the rubber gloves into the operation theatre, and the skin irritation disappeared, and ultimately they got married. But I think the story of laparoscopic cholecystectomy is one of the great Jugads, it really started with a lap instruments, and then he developed what is called as a galloscope. He put lower kind of ports, and then he tried to remove that gallbladder with all kind of techniques, and then he removed that. So innovation is a Western world. In spoken Indian language, there is no equivalent. The act of innovating is referred to as a Jugad, meaning adaptation or practical solution. So Jugad is a concept of innovation that emphasizes frugality, simplicity and collaboration. It's a way of finding creative solutions to problems with limited resources. So if you really go to Oxford Dictionary, it says a flexible approach to the problem solving uses limited resources in innovative way, or Hindi word Jugad is actually means resourceful, non-conventional way of getting things done. And I'm sure it has got frugality, simplicity, agility, unconventional thinking and community collaboration. If you see, there are so many books on Jugad which are published, and they are very well known in the Western world, and in fact Akash, which is also our Indian Jugad. And Dr. Mohan's diabetic, when he started as a Jugad, now is a 500 crore company. So why we do Jugad? Because instrument or device is not available, costly or cannot be imported, or find a doable solution to tide over a complex situation. So there are 6 Jugad principles. 1, seek opportunity, do more with less, think and act flexibly, keep it simple, include the margin of society and follow your head. These are all standard principles of Jugad which are now defined. So it is a combination of frugality, flexibility and inclusiveness. Now there are 2 economic eras in India. I always feel prior to 94, when we were very resource poor. At that time even movies were also like that. So I remember my residency when the Sengstaken tube was not available, we used to use rice tube with condoms and inflate it to stop bleeding. And this was very commonly done in my department. I'm sure Sudeep will remember it. Now endoscopic treatment of varices, we wanted to do sclerotherapy in 1982. STD and polydecanol was very costly. So we started using phenol in glycerin, available in injection for piles. And we started injecting but injection through a sclerotherapy needle was very difficult. So we started using phenol in water, and we used to create our own injector with the tubes which are available. We used to go to the market, buy those tubes, put a needle and buy those. And we published extensively about all this phenol. In fact, Dr. Mathur and we published so many articles. We put on morphological changes. We tried to study the vascularity, where does that grow. Now I went to Professor Sohendra in 1989, where I saw actually Professor Sohendra taught me how to make sphincterotomes. There are different kind of sphincterotomes, and that time I think Amit was there, and we learned how to make sphincterotomes for ourselves because they were not easily available to us. In fact, I met Professor Don Wilson at that time, the person who from the Wilson Cook, and he was the one at that time after developed all these kinds of things. In fact, we used to use nephroscopes to remove CBD stones which were retained. And that was the kind of a jugaad we used to really do. And then laparoscopy came. I'm sure Dr. Uduvadiya's, look at his box trainer. He has used what kind of a box trainers he has used. That time it was not available. So we used to use our own box, try to put some punctures and try to do it. And in fact, in 1992, these two people came to my home and they said that they want to create a laparoscopic instruments. So I told them the concept and they developed the whole industry, and now the Indian industry creates so many laparoscopic instruments, and therefore we are able to grow the laparoscopic instruments. In fact, gasless lap lift procedures, Dr. Nande really prepared for 2,500 rupees. And I think I recently saw a paper in 2023 where they are doing gasless laparoscopy for rural India registry. And in fact, he also created one instrument, what is called as an port closure. So people have been innovating in those eras in that particular time. But in 1994 afterwards, when there was a major economic change, the availability improved, but the high cost devices still continued to make our Jugad continue. And therefore something like Dr. Palnivalli created this headated cannula. You know, this was a typical Indian philosophy where how do I treat the kind of those things. In fact, fusion crisis, Dr. Jagannath created, he was not very happy with the Kuza. So he tried to use this fusion crisis and reduce the blood loss from 416 from 866 ml. So something like that, these techniques we are all the time doing, trying to use one instrument which is deemed for something, trying to use further. In fact, endoscopic ultrasound guided stenting is something which came out in a very big way. And if you really see, Dr. Nageshwar Reddy came out with this stent, you know, like we used to have these pancreatic abscesses and how to drain them. So then he came out with all these kinds of drains. And this was a wonderful paper where it came from India, where they used the magnetic compression anastomosis for post-cholecystectomy benign biliary stricture. So if you really see, they are putting one magnet from above, one magnet from below, and they are going to see that how it really goes. Now, some of these kind of things continue to happen as a Jugad in our country. Even Omar Sheikh tried these newer methods of hepatico-coloduodenostomy to compare with this for biliary tract decompressions. In fact, Dr. Nageshwar Reddy published this book of innovations in GI endoscopy, and then we used to use sometimes these nephroscopes for doing a ward. So if you really see, we have been using all these kind of whatever is available to us rather than a specific instrument to drain these pancreatic abscesses. In fact, percutaneous ultrasonography for evacuation of hereditary cysts in posterior segment of the liver. Recently, I saw a paper on new low-cost laparoscope developed to make laparoscopic surgery accessible in low-income countries. Now, the point is, when we are doing these kind of procedures like less cost by using hanging maneuver, Pringle maneuver in a left lateral hepatectomy. So, all of us, when an instrument is not available, try to adopt with something else which is easily available and try to carry out this procedure. So, act of turning problems into solution is called as Jugad. And if you really see, Jugad is an indigenous problem. I went to Industrial Psychiatric Journal, and they really said that it is actually Jugad is an indigenous problem solving approach. So they give solution focused problem solving, and they gave one effect called channel the thoughts constructively to get the job done somehow. Industrial altruism and creative thinking is a constraint environment. So they gave a wonderful kind of a triangle, recognize need, scarce resources, and creative self-interest. And they gave a flow diagram of stages of Jugad. How there is a felt need, gathering knowledge, trying out alternatives, and producing a final Jugad product. So in fact, if you really look innovations in HB surgery, people have been doing lot of modified instruments for laparoscopy. There are so many instruments available if you really go. Indigenous imaging solutions. Single incision laparoscopy was very much invented and done in India and really expanded, but again, it did not really work long. Hybrid techniques for complex tumors, living donor liver transplants, we are the leaders, and redistributive matching techniques. We also did duct drainages and anastomosis, biological glue innovations, ERAS protocols, so many things which are done in India. So although Jugad sometimes is mildly, with a different overtone we look at it, it is used by crores of Indian entrepreneurs to create effective solutions to pressing socio-economic issues. By formalizing the Jugad approach to solving problems speedily and frugally, authors have conceptualized a platform with future innovation can develop. So what is the economic impact of Jugad? On individual patient, of course, it saves money. For a country, many times if things are not available, you are able to get and you can work on whatever is available. But corporators, there is a lot of economic impact also. Look at the growth of Indian laparoscopic market. We are growing so big, and now we are likely to go much more in 2030. It's a 7.5% growth. India HPB surgical market device is also growing with 5.18%. So with so much of increasing amount of work which is being done, we need instruments, we need outcomes. So whatever is available, whatever things which are there, we can really use them. And if you really see this, again, it's a huge market. The Indian habit Jugad helps reduce healthcare costs considerably. So we need to think how we can convert this Jugad more scientifically to reduce our healthcare cost. So there are so many books I tried to read about Jugad innovations, but there is a conference of Surat Jugad Health Conference was also there. But what I realized, there is an ethics of Jugad. You know, it's very interesting to see ethics of Jugad. Normally, there are potential for unethical practices, shortcuts and bypassing systems, undermining the honest labor. Somebody has worked and he has put in his research point, we are trying to cut it short. Corruption and bribery. But there are potential for ethical innovations like resourcefulness and creativity, innovations and community-based solutions. Now, what I personally feel, there is an individual patient benefit. What we should do, understand and standardize that method which we have changed, which has worked. It's important that to see how it has worked, validate its usefulness. I think we need to find out proper data, collect that data, analyze it, say whether it has been done well, and document and publish. And now here sometimes, you know, if you're using some kind of a Jugad with some instrument, we have to really see there is no corporate issues. But if you really do it well, simple techniques can reduce the cost and we can scientifically do it much better. So in conclusion, looking back at the history of surgery provides a perspective on ingenuity and sometimes bizarre development of a man to tackle disease. The development of tools, anesthesia and aseptic techniques permanently changed the landscape of surgery, while modern advances of technology continue to revolutionize. But in this world, Jugad came with innovative and indigenous problem-solving methods. And I'm sure many of you sitting here do so many new methods. And I'm sure in working in a hospital like KEM, where sometimes you are working in a resource-poor country, you have to try so many newer things. The problem is we do not document, we do not keep a record, and we do not publish. I think the time has come when we are doing this, think logically, think whether this is a really rational way of doing it, and is it safe way of doing it, and if you are able to document it, I think that's the best way to do it. Thank you so much.